All right, welcome one more time. The program is Monday, 2015, and like we said, this evening we've been joined in the studio by Dr. Babatunde Ayodele, who is a psychiatrist. Thank you for joining us.
Thank you for having me.
And I'm sure that
Thank you for having me.
everybody's all ears want to find out. So let's take you on the first question. What has violence got to do with psychiatry?
Well, thank you for having me on your program.
You're welcome.
Hello, viewers. Violence is can be defined as a form of aggression and can be directed either towards self or to others or to the environment.
Okay.
Now, which is an act of behavior, and psychiatry has to do with behavior, whether it is normal
or abnormal.
Or it is abnormal. You need to know the normal to be able to address the abnormal. So it is a very, very pertinent topic. It is relevant in today's discourse since we're in the electoral season in Nigeria. And I think it's our viewers would have one or two things to take home.
All right, from a psychological point of view, why do you think violence seems to be very prevalent in our society? Even outside of election now, why are we having so much violence recorded?
Well, that would take us to factors that predispose individuals to violent behavior. And individuals have variable measures or variable percentages of how they may readily go into a violent behavior. And all these factors do start way back from when these individuals are in their mother's wombs. From subtle brain injuries while in the mother's womb, the form of birth procedures that the individual was delivered through.
Wow.
Yes. All this, any form of brain injury, any form of brain injury. However, you also have people that are predisposed to be found to have abnormal neurotransmitters or brain hormones, as you call them in literal parlance. Okay, and some of these hormones, serotonin or dopamine, just for mention. Now you also have other factors that may predispose, like the social environment where the individual grew up in. For example, if a child or an individual that grew up in a very hostile environment, the parents are always fighting, breaking up tables, throwing chairs across the room, being bullied in school. All these are social learnings for that individual. Okay? And when all these social learnings are gathered over time, there's a high percentage of likelihood that that individual will become violent himself. So all these factors may contribute. You also have social factors. For example, poverty is very prevalent in Nigeria. Unemployment, illiteracy level. The less educated you are, the more likely you'll be gullible to believe all sorts. Okay, street children, individuals that are homeless, they're likely going to be exploited into having being exploited to take up violent behaviors. Especially when you're talking of elections, people are ready to give them money. And also you have people that are into drugs. The social use of drugs, alcohol, heroin, cocaine, and all the other forms that have high probability of withdrawal symptoms. Since they know that they'll be given money for their violent behavior, they're likely going to want to play along, get the money to have the next fix. So the possible reasons are very myriad, yes.
All right. You just enumerated a few reasons why you think violence would is so prevalent. Now let's relate this to your field of study, psychiatry. Are there some manifestations you will see in someone to let you know that this person is predisposed towards being violent?
Yes, I've mentioned some. Studies have shown that individuals that that are violent tend to have a form of personality, which we call the antisocial personality disorder.
Okay.
The Americans call that the social personality disorder.
Right.
Now, the characteristics of individuals that have this are, during the time of growing up, you see these individuals begin to show the traits of being very disobedient, unruly. They are very unremorseful when they commit crimes. They have no respect for law and order. They are readily involved in arson, destruction. They take out their frustrations on others, and even possibly enjoy some of these things they do. So the potential for violence is there. Now, other properties or other factors that you can see that go along with this, what I've painted for you, are the use of drugs. When you have, as from a very tender age, children, young adolescents begin to take drugs, the likelihood of going into violence is there, because they tend to have withdrawal symptoms.
Okay.
Withdrawal symptoms themselves can lead to violent behavior. And if these are exploited by the political environment, definitely they go into electoral violence or committing violence due to elections.
All right, before we came into the studio, you were telling me something that the recent study shows that over 100 people have died between January and February during the election campaign.
December to date.
Okay, since December to date, till last week, over 100 people have died already.
Yes.
Now, seeing that this rate of violence is quite high, do you think that government will be able to harness or salvage rather this situation in anytime soon?
Well, that is more like a political question. When there is a will,
there is a way.
There's a way. We have, I believe in the capability of our security forces in Nigeria, just as evidenced by the military, having waited for so long. When they decided, or when the time was right, they began to record successes. So if all the security apparatus are put into proper use, I believe, and following the laws of the land, a lot of these violences can be prevented, even before and towards these March 28 elections that we are performing.
All right. Now, you have enumerated a few points which I find very, very interesting, and which are eye-openers, I'm sure, to a lot of people who are watching. Now, as a medical doctor, what would you advise that parents do when you start noticing these traits being displayed by your children? What points should a parent begin to worry, and then what should be the next line of action to do as a parent?
Well, for every child, every individual, every child should be viewed as a whole. You have to think of the biological constituent of that individual. You have to think of the psychology of that individual, and also the social environment of the individual. For a violent behavior to come to reality, all these factors would have played.
Okay.
So when you begin to have a child that begins to show some of these tendencies, then you need to look into the environment. Where is he having some of these learnings from?
Talking about poverty, talking about
employment.
No, specifically let's look at a child that has no reason to be violent.
Okay.
And then you begin to see
some traits.
Now you need to look beyond the home, where he's not likely learning that from.
Okay.
Look at the school, look at the type of his friends.
Peer pressure.
Is he being bullied? And then he's beginning to reenact his own experiences on others. Okay, you need to look, is he into drugs? Okay, you need to look at even the possibility of developing, or should I say, a transient or an unobvious psychiatric problem. that he's developing, or it's a personality disorder that he's developing. What you need to do is, of course, every parent wants to talk, to advise, to admonish, to want to talk out the child from such behaviors. But if it gets to a stage where you feel you are unable to cope, or the child is becoming injurious to others, to himself, to members of the family, then we have a lot of psychology or psychiatric centers in the country.
Well, those are even parents who are observant. Some parents will not observe.
Talk about a peculiar place like Lagos, where a parent leaves home as early as 5 a.m. and doesn't come back until like 11, 12. You're likely not going to see some of this. So
it comes to priority. Let's prioritize our homes, our jobs more important than our home front. So that's the priority we need to address. I want to mention some of the consequences that violent behaviors can bring, either to the victims or to the society. Now you have a violent experience at Mushin recently, where houses were burnt, cars were burnt, individuals were killed. Now imagine an individual that experienced witnessing a near-death situation, but was able to survive and went back home. Now you see people that experience violence, either as witnesses or victims themselves. They have problems like sleep problems, insomnia, parasomnia. They have night terrors, nightmares, where they're unable to sleep. You know, they could develop what you call anxiety problems. Well, for example, you can have panic disorders, you can have phobic disorders, which specifically like developing fear, even having to go through motion again. Okay?
Having to pass through the same place.
Through the same place. It's that simple. It could be as simple as that, and nothing would make them go through that place. Otherwise, they go into hysteria, passing through that place. You could have depression, having lost somebody to violence. You saw someone kill somebody you know or related to you. You develop depression, and depending on how close the person is to you, depression could be so bad that the person might commit suicide. Okay, you have even psychotic problems, from the acute to the chronic. Somebody just begins to behave as if he's not in touch with reality. Okay, so you have a lot of these things. Even if a violent experience can even tilt somebody to go into drug use as a way to cope with the experience. Going to use of alcohol, Indian hemp, cocaine, heroin, you know. So the complications are there, and it's best to prevent. When it comes to psychological problems or psychiatric problems, it's always best to prevent than to manage. Even for children. So even for children that experience these things, all these things I mentioned to you in adults are also found in children.
Yes, I was going to say that. Can children experience all of these traits you have enumerated? Can they experience
the traits?
Yes.
The psychiatric problems.
Can they?
Yes, they can go through depression, anxiety disorders. They go into even for the children is even worse, because they are just developing. They are in their developmental stages. The brain is still trying to find itself. Their personalities are being formed, and then they have to subject themselves. I mean, people have to subject them to such horrid experiences. And then, but let me give you some specific ones for children that have to do with their age bracket. Let's say from the learning group, inattention in school, their grades begin to go down. Some of them develop enuresis. Yes, bladder control. They lose their bladder control. A child that is 7, 8, 9
begins to weigh on his body.
Yes, I've been involved in. I had the opportunity of managing a young girl a teenager about 11, 13, who lost. Armed robbers came to the house and shot the dad. And this is a girl that was already in boarding house. She couldn't stay in school. Before you knew it, she started urinating in bed, became unruly in school. That's a form of violence, though not electoral in nature, but violence is violence. It's a form of aggression, like I said earlier on. But that was the result on the girl. And
right. Now, I'm so interested in this because maybe if youth get to know of the impact of these on them, maybe to a large extent it could help curb being used by politicians, to perpetrate trouble or foment violence. Now, I wanted to go back to the issue of if, for example, a teenager maybe was at a rally and then he or she sees people being shot at, what effect do you think how can this affect him or her? How can that scenario affect him or her?
For a teenager to see guns flaring off, like I said, any of these ones I mentioned earlier could happen, but specifically, what I could say, different from what I've mentioned before, is that you may begin to consider that individual as, like I said, every person has his own predisposition to specific forms of psychiatric problems or psychological problems. But if you have somebody witnessing people being gunned down, the likelihood of such a person getting home and then, it's like
reenacting it.
Yes, everything becomes like a reenactment of the memory of what you've seen. So you can have sleep problems, unable to go to bed, to sleep at night, becomes fearful. Okay, it might even be a color. Perhaps the people that were killing, maybe the supporters in quote, that maybe they were wearing red. The people that were shooting were wearing red. Anytime this teenager sees anybody wearing red, he goes into a fearful state. And so they are there. Okay, going to sleep. The teenager could go back, like I said, into losing many of the controls, losing, going back to an anoretic state, begin to urinate again. So
losing concentration in
school.
And becoming violent.
Might begin to act out herself or himself, getting back at others, begin to act violent.
So should we think that the youths and teenagers being used by politicians to perpetrate their violence are actually disposed to violence? Is that what you're trying to say? That maybe they've had some things happen to them that makes them disposed to violence, meaning maybe they're not the normal.
Not everybody.
Okay.
Not everybody that goes into electoral violence behavior would we say is actually predisposed, because except we get all of these individuals and then test them. However, some of the factors that predispose undergraduates, you mentioned undergraduates
poverty,
to this.
Unemployment and all of that.
Yes, one is what is the academic curriculum or the nature of why are they so less busy that they have time to get into the roads for electoral violence. That was one. Two, many of these so-called students are not in school. So you have a basket full of poverty, unemployment, should I say
environmental factors, like you said.
Let's mention drug use.
Okay.
Let's mention being on the streets. So you have them. Many of these individuals. What is the percentage of individuals in university in Nigeria compared to what you now actually see? So it's a mixture, it's a basket of all sorts of individuals. But for a student that knows his onions, that knows the purpose of education, definitely would not be found perpetrating violence because of election.
Okay, what of social media? Does it have anything to do with this issue of election violence?
Yes, definitely. The media has a great role to play in education, by certain examples. You see, when you have news, a lot of negative news going on air, people see it, they become sensitized to violence. Let me give you an example. When the ISIS killing started, most of these Western media were showing them. But today they've stopped because a lot of people in their individual countries are seeing examples of what these people do. You put people on air and then you cut off their heads.
So other people
Okay, so now if you watch CNN, watch BBC, watch Sky TV, they've all stopped. So the social media, all forms of media, they have a great role to play by the content of what they release to the people. Social learning, like I said, the social environment dictates part of the content that the individual learns from. And what you see on TV is part of it. What you read in the books is part of it. What you learn from your friends is part of it. So I believe you people are doing a great job here by reducing and preaching peace. We must preach peace, we must preach electoral or political tolerance. I don't need to agree with you, but I'll respect what you have. I mean, respect your opinion, and I expect you to respect mine. After all, everybody has one vote to himself.
Right. Thank you very much for being a part of the show. Well, in case of just joining us, the program is Monday 2015. We'll be talking about the effect of violence on our society. And in-house we have Dr. Babatunde Ayodele, who is a psychiatrist. Thank you for shedding light on this. And we hope to have you